And we've got clinical case, my beloveds. A 42-year-old man presents with progressive shortness of breath, orthopnea, and swelling of his ankles for the past 6 months. He has a history of chronic alcohol use, progressive shortness of breath, orthopnea, and swelling of his ankles for the past 6 months. History of chronic alcohol use. On examination, his blood pressure 160, mercury of course, heart rate 110 beats per minute, and jugular veins distension is present, heart failure. Third heart sound, S3 is audible, gallop. Chest X-ray shows cardiomegaly, and echocardiography reveals a dilated ventricle with reduced ejection fraction, 25%, and global hypokinesia. Hypokinesia. So question is, what is the likely underlying mechanisms in this patient's condition? Option A, concentric hypertrophy due to chronic pressure overload. No, of course. Restrictive feeling due to amyloid infiltration. No. Myocardial contractile dysfunction secondary to toxic injury. That is dilated cardiomyopathy. And left ventricle outflow obstruction due to septal thickening. No. So correct option is myocardial contractile dysfunction secondary to toxic injury. Why? This is a classic cause of dilated cardiomyopathy caused by alcohol, chronic alcohol use, abuse of course, which leads to direct toxic damage to cardiomyocytes and results in ventricle dilation and systolic dysfunction. Option A was about concentric hypertrophy seen in hypertensive or aortic stenosis related heart disease. We do not have this. Next, restrictive feeling, option B actually, typical of restrictive cardiomyopathy. That's why question about amyloidosis. No amyloidosis, no sarcoidosis, typical for restrictive cardiomyopathy. And option D, left ventricle outflow obstruction, characteristic of hypertrophic cardiomyopathy, not dilated. So correct option is myocardial contractile dysfunction secondary to toxic injury, my beloveds. This is a classic case of dilated cardiomyopathy caused by abuse of alcohol, which leads to direct toxic damages of heart muscles, cardiomyocytes, and results in ventricle dilation and systolic dysfunction, i.e. heart failure. Okay, stay blessed.